Sise Ndagire is a youthful mother from Kamwokya. Today, she's queuing up for her routine antenatal checkup at Kamwokya Care and Christian Community Health Center, the same facility that supported her through 2 previous pregnancies. But Ndagire's journey into motherhood hasn't been without pain. She lost her first baby during childbirth due to delayed access to care and lack of proper birth preparedness. She said the health workers attributed the death to probable birth asphyxia, one of the leading causes of neonatal deaths in Uganda. Other major culprits include prematurity-related complications at 18% and sepsis at 7%.
My mom didn't have money, so we spent a long time trying to find an ambulance or better transport. By the time we reached our referral destination, the child had died.
These aren't just statistics. They are real stories, like Ndagire's. And they highlight a larger systemic issue, delays in healthcare access that continue to claim lives across Uganda. These delays are often caused by a combination of factors, from inadequate health infrastructure, staffing shortages, and logistical bottlenecks to patients arriving late due to lack of awareness or finances. Despite Uganda's 2001 commitment under the Abuja Declaration to allocate at least 15% of the national budget to health, the country still struggles to meet even half of that target. The consequences are evident in communities like Kamwokya. Kamwokya, a sprawling urban slum in Kampala, is home to nearly 40,000 people, surrounded by national referral hospitals like Mulago, Naguru, Kawempe, and others. Yet, for many residents, quality care feels out of reach.
The health workers here care. They continued to check on us. That is why I am back to give birth here.
Like Ndagire, a number of Ugandans now turn to private or non-profit facilities, not because government hospitals do not exist, but because satisfaction and trust are often lacking.
75% of us who work here are community members, but we also collaborate with the LCs. We work with the LCs. The LCs help us to identify and recommend patients here, but also they help us in the follow-up, especially when it comes to care for TB patients and other kinds of identifying who should be supported, the real needy that need help. And currently you find people even coming as far as Ntinda to seek for services from here.
The center serves thousands but struggles with limited resources.
Annually we had around 44 women delivering from here. But as we talk now, annually we have about approximately 200 women.
We always had a challenge where if the baby is delivered, we do not have the supplies for oxygen. We can only refer to Naguru Hospital or Kawempe. And in the process of referring the mother, it is easy to lose that baby.
However, in 2022, help came from the Rotary Club of Chitante, which donated vital equipment including microscopes, vein finders, and electric kettles. This seemingly small boost had a big ripple effect. Diagnostic services more than doubled, and more residents sought care at the health center.
The hospital previously was seeing around 2,000 patients in a year, but right now we are shooting up to 5,000. This is because we are now able to do more services.
We are doing a lot with the vaccinations. Actually, on a weekly basis, we have over 200 the mothers visiting for vaccines. One of the biggest programs that we are running also here is provision of care, support and now treatment for HIV/AIDS patients, where we have about 3,000 individuals who are getting treatment and care.
If you look through Kamwokya, there is a lot that needs to be done with their schools, with economic empowerment, with hygiene and water and sanitation. So we felt that it was just the right place for us to be.
Still, many who come through these doors cannot afford to pay for the services they need. To keep running, the center introduced a cost-sharing model for those who can contribute.
But we are grappling with that. We seek support from other people who support us to subsidize for those who cannot pay.
Globally, the World Health Organization warns that over 1 billion people risk falling into poverty due to out-of-pocket healthcare costs exceeding 10% of household income. Uganda is no exception. The World Health Organization states that a scale-up of primary healthcare services is likely to save more than 60 million lives and add at least 3.7 years to life expectancy by 2030 globally. Yet Uganda's spending on healthcare remains far below global and regional expectations. In the 2025-26 financial year, the health sector was allocated just 5.7 trillion shillings, or 6.1% of the national budget, less than half of the Abuja target.
We would recommend, like we have always told the government, if our national referral hospitals, Chirudu, Kawempe, and Molaga, are to perform well, the human resource, the most critical human resource, the associate consultants, must be paid a salary that is befitting the services they are providing. Number two, we also need to increase on the number of equipments which are required in these hospitals. I know there are a number of equipments which are lacking. And then the diagnostics. Chirudu and Kawempe are still sending patients outside to go to private facilities and do tests, like the thyroid function tests and many others. And in the process of sending patients to go and pay for those services outside, there some of them get lost. Others don't come back because they fail to find money to go and pay for these services, to do the tests and come back to the doctors.
Access to quality maternal and primary health care is not luxury. It is life-saving necessity. In a system where every minute counts, delays can mean the difference between life and death. Perhaps what Uganda needs is not more of facilities, but more functioning ones, closer to the people who need them most. The story of Kamwokya Christian Caring Community basically explains how simple things like investment in vital tools for health care providers can actually help in service provision. For example, here, the acquisition of an extra microscope was able to help them conduct 3,000 malaria tests for free, and were able to confirm more than 1,000, which previously wasn't the case. And this also helps to feed into the larger structure, maybe which government can benchmark on how to improve service provision in healthcare. Walter Mwesije, NTV, Kampala.